Good afternoon. Welcome. We're going to begin in just a moment. We just wanted a chance to let everybody in to welcome to the Jewish Federations of North America's Center on Aging, Trauma, and Holocaust Survivor Care informational session for the request for proposals. This is for the Innovations in Person-Centered Trauma-Informed Care for supportive services for Holocaust survivors, older adults with a history of trauma, and their family caregivers. Some housekeeping items are that this will be recorded and posted on our website on the call for applications page. Please ask any questions you have in the Q&A box at the bottom of your screen at any time, and we will address them at the end of the webinar. If you have follow-up questions after this webinar, you're welcome to email them to us until April 24th about the content of the RFP. We will not be providing feedback on idea proposals. And lastly, all resources mentioned here can be found on the Call for Applications webpage. Next slide, please. So first, I'd like to introduce myself and my colleagues. My name is Leah Miller, and I'm the Director of Programs and Training at the Center. And also presenting on this webinar are Alana Napo, who's the Assistant Director of Programs and Training, and Amanda Jarvis, who is also the Assistant Director of Programs and Training. And before we continue, I just wanted to give a special thanks to our CEO, Eric Fingerhut, and also to the leader of our center, Shelley Rude-Warnick, who's the Associate Vice President. So thank you so much, Shelley, for your leadership. We've appreciated it throughout the past 10 years. So Jewish Federations works to build flourishing Jewish communities that are healthy, safe, caring, and inclusive. We represent hundreds of communities across North America that support people of all backgrounds, races, and religions. We are proud to partner with the Administration for Community Living to improve lives for older adults with a history of trauma. For Jewish Federations, supporting Holocaust survivors has always been core to part of the mission. Holocaust survivors, in turn, have inspired our work around the person-centered, trauma-informed approach and have taught us how to better serve all older adults with the history of trauma. Next slide, please. We encourage you to follow along this presentation with the request for proposals open, and this is how you access our request for proposals. You'll also see all of the tools that you need for the application here. Next slide, please. And after this, we will post this recording and all questions and answers on that webpage. In terms of the agenda, we're going to cover background about Jewish, and we're also going to provide an overview of the RFP and program guidelines, including the grant overview, funding awards, requirements and compliance, application review process. Of course, we'll also show you how to use SurveyMonkey Apply, which is the software through which you'll be submitting your application, and we'll have a time for questions and answers. Next slide, please. The grant overview. Next slide, please. So first, we want to give a special thanks and recognition to the Administration for Community Living, which is housed within the Department of Health and Human Services, for recognizing that the history of trauma matters as people age, and for ensuring that aging and trauma remain a public matter. As a recipient of federal funding, Jewish Federations and our subgrantees adhere to the President's executive orders and all guidance issued by the U.S. Department of Health and Human Services. As you consider your proposed projects for this federally funded grant opportunity, it is advisable to read more about ACL's mission, vision, and priorities on their website, as you can see linked here, and we'll send it again after the webinar. Next slide, please. So to give you some background on the center, you'll see that, first of all, at the top left corner of your screen, you'll see where we are in the RFP. So we're in section 1.0 of the grant overview. We've been partners with ACL since 2015 to advance person-centered trauma-informed care for Holocaust survivors, different populations of older adults with a history of trauma, and their family caregivers. And we do this in two ways. One is through issuing subgrants like we're doing right now. And the second way is providing education and training to the Aging Service Network. Next slide, please. We are a hands-on funder. We not only provide the funding, but we also provide training. So we have mandatory webinars throughout the year to ensure that everybody has the same access to information and can be leaders in their community on the person-centered trauma-informed approach. We also have quarterly individualized coaching with subgrantees and also group coaching sessions as well. We provide evaluation technical assistance that is specific for your grant, and you'll take what you learn from this grant and be able to apply it to other programs you run at your agency. And lastly, we collect data to conduct research and publish reports on what we learn from our subgrantees' best practices. Next slide, please. And here I'd like to pass it on to my colleague, Alano.
Thank you, Leah. So I want to let you know that for this next section, as we talk about the content of the request for proposal or RFP, I'm going to be moving rather quickly because all of this information can be found within the RFP in much more detail, and because we want to allow as much time for your questions so we can answer them at the end as possible. So please feel free to enter your questions in the Q&A as we go, and we will get to them at the end. So the PCTI approach is the person-centered, trauma-informed approach, which is a holistic model of care that promotes the health and well-being of individuals by accounting for the role of trauma across the life course and by resisting re-traumatization, while also focusing on the strength, agency, and dignity of the person receiving care. Next slide, please. The PCTI principles can be found here in this visual on the right. You'll see the person-centered principles on the outer ring and the trauma-informed principles on the inner ring, and any of them are meant to interact with each other. So the PCTI approach implements SAMHSA's principles of trauma-informed care through the lens of the person-centered principles. Next slide, please. We encourage you to explain in your proposal how you will be incorporating each of the or any of the PCTI principles. For this grant, you are applying to our innovations grant if you are going through and interested in that. And the overview of the grant is that innovations programs grants are awarded to organizations to develop, implement, and evaluate innovations in PCTI care for Holocaust survivors, older adults with a history of trauma, and their family caregivers. Programs can include physical health and wellness, mental health, cognitive support, socialization, family caregiver support, and case management, as well as other programs. Next slide, please. For this grant, the definition of innovation is thought of as an introduction of a new or expanded idea, method, product, or service to meet unmet community needs. Proposals can be innovative for the field, organization, or program. And keep in mind that what's innovative for one organization might not be innovative for another, depending on your service area and population served. So below is a list of examples that could make a proposal innovative, which are that they serve a community need or problem in a new, expanded, or different way. They implement a new or expanded service delivery method, or they utilize volunteers in a new, expanded, or different way. And that is not a comprehensive list, just some examples. It is not considered innovative to increase participant numbers in an existing program without implementing a new or expanded concept, or continuing an existing project or program without any new enhancement. Next slide, please. The definition of a project. Applicants must propose at least one project and may propose as many as two projects. Proposals must describe in detail each project and submit a corresponding budget, and we'll talk more about that later. The number of proposed projects will not influence the proposal score. And We ask you to think of a project in the following way, that it's composed of one intervention, which is supported by multiple activities in service of at least one service population and results in one main outcome. Next slide, please. So I'd like to define each of those terms in that equation, starting with an intervention. An intervention is a method or process to prevent harm or improve functioning. There can only be one intervention per project, and we've listed some examples. Of course, there are many more. And it's important that every intervention in this innovations program must be person-centered and trauma-informed, incorporating those principles. Next slide, please. An activity is thought of as a task implemented to support the effectiveness of the intervention. And I want to back up to point out that in addition to the RFP, we also have a document on our call for applications page that is called How to Define a Project, as well as a corresponding video, and that those resources will go into further detail about all of these items that make up a project. In terms of an activity, there should be multiple activities within one project, and all activities listed for a project should support the project's intervention. For example, a chair yoga project could entail the following activities: conducting outreach to participants, training staff in PCTI care, providing chair yoga sessions, conducting an evaluation of project outcomes, and grant administration tasks. A project should not include activities that don't directly relate to the intervention. Next slide, please. An outcome is the result of a project on participants. Examples are improve mental health among family caregivers or reduce social isolation among Holocaust survivors. And we are evaluating every project in the program to determine how the proposed intervention achieves the suggested outcome. And while projects may achieve many outcomes, for the purpose of our evaluation, each project should only have one primary outcome, which are as follows. Next slide. You'll be asked to select one primary outcome for each project from the following, and this is a list of your options. They are improve physical health, mental health, social health, spiritual health, access to home and community-based resources, financial health, family caregiving experience, and understanding of the PCTI approach. And again, you'll find a description of each of these in the resources on the call for applications page. Next slide, please. Service populations are the intended project participants, and at least one service population must be served per project, but projects can serve multiple service populations. So a project should serve Holocaust survivors or older adults with a history of trauma age 60 or older, or family caregivers, or any combination of those. And either the older adult must be age 60 or older, or the family caregiver. Next slide, please. You may have a project that serves supporters of service populations. These projects are defined as, in terms of, supporters of the service populations are defined as professional service providers, which is an individual who is employed or contracted to provide professional services to one of the service population participants, or a volunteer who, again, is providing services but in an unpaid capacity. So, at least one of your projects has to serve the service population, and one project may serve the supporters of service populations, but you cannot only apply for funding to support supporters of service populations. There does have to be a direct service component in one or both of your projects. Next slide, please. Grant awards. Next slide, please. In terms of whether you are eligible to apply, here is the eligibility set of requirements. You must be based in the United States and fall into one of the following organizational types, which are domestic, public, or private nonprofit entities, state and local governments, Indian tribal governments and organizations, faith-based organizations, community-based organizations, hospitals, and institutions of higher education. And the RFP does go into more detail about these. Next slide, please. Further eligibility requirements are that you must be a direct service provider to one of those three service populations, have at least one audit report that includes a management letter, consolidated statements of activities, functional expenses, and cash flow. You have to have a unique entity ID by the time um, the the organization receives funding, and you must accept the terms and conditions of our cooperative agreement, which again can be found on the call for applications page. I encourage you to review the cooperative agreement with your agency leadership prior to submitting the stage one application. We would not want you to get into a situation where you've put in all the time and work to submit the application only to find out that you're not able to accept the terms of the cooperative agreement, because the cooperative agreement cannot be modified. Next slide, please. The grant timeline will be in an 18-month total timeline divided into two 9-month periods. So we ask that you consider this an 18-month program and propose an 18-month budget. And the two timeline periods are listed here. Period 1 is January 1st, 2027 to September 30th, 2027. And period 2 begins October 1st, 2027 and runs through June 30th, 2028. And we always like to remind you that we can only commit fully to the first period because the second one is pending congressional appropriations. And if that does indeed move forward, then we would also be looking at subgrantee compliance with all program requirements and the success of the subgrantee projects. We intend to award the same funding amount in program period 2 as awarded in period 1. Next slide, please. For this grant, applicants must propose one of the following funding levels. Option A, which is $60,000 each program period for one or two projects. That's across that is resulting in an 18-month total award of $120,000, or option B, $105,000 each program period for one or two projects, resulting in an 18-month total award of $210,000. The funding levels requested must be the same for both program periods. So an applicant may not request 60,000 in program period 1 and 105,000 in program period 2. They have to be the same. And applicants also have to evenly distribute funding over the 18-month course of the grant. And please note that you cannot ask for funding amounts other than these two options. Next slide, please. If you choose option A of a request for $60,000 per program period, here is how that breaks down in terms of the match. So applicants will be required to contribute a match funding at a level of 25% of the total program budget and will be responsible for raising the match funding in both program periods if program period 2 funding is available. In option A, with a request of $60,000 from Jewish federations, a $20,000 match will be required in each program period for the subgrantee to raise, and the total 18-month match requirement will be $40,000. In option B, with a request of $105,000 from Jewish federations, a $35,000 match will be required in each program period, and the total 18-month match requirement will be $70,000. So Jewish Federation's grant funding plus the required match equals the total program budget per program period. Next slide, please. This slide details the same for what that would work out to for funding option B. And subgrantees must secure their match for period 1 by June 30th, 2027, and for period 2 by December 31st, 2027. And subgrantees will be required to submit evidence of their match once per period. Next slide, please. There are a number of funding limitations that are outlined in further detail in the RFP. They are listed here. I'm not going to read out all of them, but please note that fundraising and lobbying activities are included, as well as office equipment and construction. These are all limitations. You can see them here. In terms of medical expenses, we're talking about those that are reimbursable in whole or part by health or medical insurance. Um, Whether that's private health insurance or Medicaid or Medicare. This is not a comprehensive list, but please see the RFP for further details before submitting your budget. And please check your budget against these limitations before submitting your budget. Next slide, please. Requirements for compliance. Next slide, please. So you will be required to complete our new 1 hour online course about the PCTI approach. This is going to be an introductory course, and it will be required within the timeline that we provide. It'll be mandatory for all staff and vendors charging time to this grant as listed on the budgets. If there are staff changes during the course of the 18-month period, then a new staff member replacing a staff member or being added to the budget would be charging, who's charging time to the grant must also take the course. And you'll also be asked to participate in quarterly check-in meetings. That's where each sub-grantee is assigned a program manager as well as an evaluation manager and finance support. And you'll be meeting with us one-on-one to talk through your progress and challenges and where we can provide coaching and also learn promising practices from you that may benefit the entire cohort. You'll be asked to join webinars on topics related to the service populations, and that will let you know which ones are required, and we will be tracking attendance. And we'll also be hosting an annual in-person training event that could be our training workshop or another event. This is not a comprehensive list. You'll see more in the RFP. And if we request to visit you for a site visit, we will work with you to schedule and plan that as well. And that will also be considered required. Next slide, please. There are also evaluation requirements for data collection, and you'll have responsibilities such as completing evaluation reports, administering our common evaluation strategy and submitting the data to us, and participating in mandatory evaluation trainings and consultations. So we've been refining our evaluation process over the first 8 years of the grant to create this common evaluation strategy. This was an effort to make it easier for agencies and create a larger data set among agencies. And we do provide the coaching and all of the tools you'll need to do this. And we've crafted PCTI questions and only ask what we need to for brief surveys to protect the time of your participants and staff. Next slide, please. There are a number of reporting requirements, including quarterly financial workbooks, including financial reporting and the evidence of match, quarterly project participant reports, a programmatic report that will be recurring, a work plan, evaluation update report, and there will be an optional survey on our technical support, a final report, and there may be other forms that we'll ask you to complete as we go. You can find more on these on our call for applications page. Next slide, please. The application and review process. Next slide, please. Starting with our application timeline at the top, the Monday, March 30th informational session, that's where you are now. Thank you for being here. The next piece in our timeline will be the intent to apply, or you may also see it referred to as an LOI or letter of intent. That will be due April 15th. April 24th is the deadline for submitting clarifying questions about the RFP. Again, we will not be including answers to questions about ideas for proposals. The reason that we are only accepting those questions through April 24th is so that we can post the answers on our website and so that no one submitting a question after that date would be at an unfair advantage from those who submitted questions before that date who don't have access to your answers. The stage 1 application is due May 15th, so 1 month after the letter of intent. And then from the course of June through November, we'll be notifying applicants of whether or not they're advancing to stage 2 and when their stage 2 application is due. December is when the award announcement will be made and the signed cooperative agreement will be due. And then Monday, January 1st, 2027 is when program implementation begins. Next slide, please. Um, the intent to apply, as I mentioned, or letter of intent that is due April 15th is your basic information, eligibility questions, and must be completed in order to apply for funding. So you don't have to apply for funding if you submit a letter of intent. Plenty of people submit a letter of intent or intent to apply and don't end up going through with the funding application. That is just fine. But note that you cannot submit a funding application if you haven't submitted the intent to apply. And it's very brief to submit, so if you're considering it at all, we strongly suggest you do submit an intent to apply. Next slide, please. The stage one application is going to include a questionnaire, and you can find the full questionnaire in the RFP, the work plan, which we'll talk about shortly, the budget application workbook, and financial documentation. Those are due May 15th, and we suggest that you submit those 3 days prior in case you run into any technical issues. Next slide, please. The stage two application, we will notify applicants whether the application is advanced to stage two. This will be after the stage one application is scored against a rubric by an external review committee. So we will be allowing time for that external review committee to provide those scores to us. And if you do advance to stage two, we will counsel applicants on how to modify their proposal to meet available funding and respond to the review committee's questions and comply with guidelines. During stage two, applicants will submit an application questionnaire, budget workbook, and work plan, as well as banking information. And this will be reviewed by Jewish Federation staff according to a scoring rubric. Next slide, please. The review process, as I mentioned, for stage one is a volunteer external review committee, and it is rated on a spectrum ranging from insufficient to average to excellent. The lowest number of points indicates an insufficient response, and the highest number of points indicates an excellent response. If you look in your RFP at the questionnaire section, you will see how many points each question is weighted. And the review committee is comprised of professionals and lay leaders with extensive knowledge of aging services, family caregiving, program planning and evaluation, and trauma-informed care and organizational capacity building. They'll be trained on the review process, and questions will be worth 0, 5, 10, 15, or 20 points each. And we have tried to be as transparent as we can about this process. Next slide, please. This is what will be included in the stage one application questionnaire. Again, it's basic information, the project questionnaire, organization capacity and grant sustainability, work plan, budget application workbook, and a number of additional documents, all of which can be found on the call for applications page. You'll see samples of a number of these as well as templates for them. Next page. The sample work plan, which you'll find the sample and template for on the call for applications page, which, by the way, my colleague Amanda has been pasting into the chat this whole time, so you'll have that link handy. Thank you, Amanda. This is what the work plan looks like briefly. You should include outreach, training staff, if applicable, the frequency of events, reporting, evaluation, and of course, the RFP will provide more guidance on what to include. Next slide, please. There's also a sample budget application workbook on the call for applications page and a template for it. And it has 3 components: a questionnaire where you'll be indicating your requested funding level and providing background around your organization's experience managing different types of grants, instructions for completing the project budget proposals, including important guidance around financial compliance, templates for individual project budgets as shown on the slide, in which applicants will attribute project-related expenses to grant funds, financial match, or in-kind contributions. And we'd like to provide a reminder that your total program budget includes grant funds and match contributions. Match contributions are bound by the same policies as grant funds, so that includes all of the limitations you'll find in the RFP that we mentioned earlier. An important overarching policy for federal grant funds is that all expenses allocated to project budgets must be reasonable, as in costs must be consistent with fair market value. Necessary, costs must be essential to achieving the approved project objectives, and allocable. Costs must be charged to the subaward in proportion to the benefit received. If an expense supports multiple projects, only the portion directly benefiting this project may be charged to this budget. Again, you'll find all of this guidance and more in our RFP. And next slide, please. At this point, I will hand the presentation over to my colleague Amanda Jarvis, who will walk you through how to apply through our software SurveyMonkey Apply. Thank you.
Thank you, Alana. Happy to be with you all today. Next slide, please. As we discussed earlier, you can find detailed and user-friendly SurveyMonkey Apply instructions on that call for applications page. These instructions were designed really intentionally to apply to any comfort with technology that you may have. It's a pretty intuitive process, and we are here for you if you have any issues. So let's begin. When you begin, if you have never created a SurveyMonkey Apply account, or if you have, but not with Jewish Federations of North America, you'll create a new SurveyMonkey Apply account. And so you'll do that by clicking on this link that is here. You can also find it on the call for applications page. We really tried to create a centralized location for anything you might need to apply for this grant. So you can register, fill in the information, click create account. You're going to get, as if you were creating an account anywhere, you'll get an email verifying your identity. So you'll have to go to your email, find that email. If you don't see it there, go to your spam. If you haven't seen it in a few hours after you've registered, you can go ahead and try to contact us here at aging@jewishfederations.org, and we can try to help you out that way. But you're going to finish your registration, you'll go to your email, you'll complete the registration by clicking through that email verifying who you are. Then you'll be directed to the login page where you'll log in using the information that you just created when you registered. So you'll click login. Can you go to the next slide, please? Thank you. So after you log in, you'll see a page that says View Programs. You'll click that, and you'll find the application that says Jewish Federations Innovations Program Application 2026. You might see a few others, but that's the main one that you'll want to click on to get to our grant. If you're ever in doubt, look for the one that specifies Jewish Federations Innovations. And so you'll click on the More button when you see that square, and you'll get to the page where you can then click Apply. That Apply will take you to a page where you click Start, and then you can start filling out the letter of intent. It's otherwise known as an intent to apply or an LOI, and all it is a declaration that you're intending to apply for this grant. As Alana said earlier, if you fill this out and decide later it is not right for you or your organization, that's totally fine. You can still participate in future webinars. You can fill out intent to applies in the future. You don't have to fill out an application if you fill out an intent to apply, but I just wanted to reiterate, you must fill out an intent to apply if you plan on filling out an application. And so you're going to fill out the intent to apply, which is, as Alana mentioned, really just basic eligibility requirements. If you answer no to any of the eligibility questions, you're going to get a response that says that you're not eligible for this grant. And that is to help you prevent from spending too much time on something that your organization is not eligible for. If there are any questions or you feel that you may have received this message in error, please do reach out to us. Again, it's aging@jewishfederations.org. As you're filling out this form, SMA, SurveyMonkey Apply, I'll call it SMA, it automatically saves what you fill in. And you can also, there's an option to save and continue. And so you can save and continue as many times as you'd like, and it won't submit your application until you do the following. You must mark it as complete and then submit. I know it's 2 steps. However, if you mark it as complete, then it will mark it as 100% complete, and then you still must submit it. This is to give you an extra opportunity to review, make sure there's nothing you need to edit, make sure you feel like you've answered all the questions to the best of your ability, or you can show it to somebody if you need to, and then you click submit, and that is what gets it to us. If you are eligible for the grant, you will then be sort of pulled through the system, and you'll get to start filling out your stage 1 application. Will you go to the next slide, please? Thank you. So again, you can take a break between these items. You can do it on the same day if you'd like. The application will be more time consuming than the letter of intent or the intent to apply. So make sure you plan around that. But you can start and stop at any time as long as you save and continue later. So you're going to return to your login page if you're outside of it, and you're going to log in using the information you entered when you registered for that SMA account. You will then navigate to the Jewish Federation's Innovations Program Application 2026, which is the application for this grant, and you'll find the application and click Start. And you can click anywhere on that to start your application. Let's see. Can you go to the next slide, please? Thank you. Let me get through a little bit more of the application so that I'm as thorough as we can be for this. And so when you submit the letter of intent, you'll get an email. And when you submit this application fully, you'll get an email to confirm that you submitted it so that you don't have any questions about that. If you want to look at it after you submit it, you can totally do that also. Just go ahead and log back into your account, and you can navigate to your application there, and you can download it if you want access to it at another time. All of the components of the application that you might need, any templates, any forms to review in advance of sitting down to fill out the application, can be found on that call for applications page and on the RFP. So let's see. When you complete the application, as I said, you'll get a confirmation email, and you can go back and view it later. If after you submit, you need additional help, or if you need any help with the overall application process, you can reach out to us. If it's content related, please reach out to us at aging@jewishfederations.org. If you think it's something that is a computer issue that you have gone through your internal technical support, IT support, and you're still having trouble, you can go ahead and navigate, as you can see on this screenshot here, to the top right hand. And to the right of that little I will be your name. And to the left of your name will be this little I. And you click that, and it'll take you to a help page where you could then contact customer support through this portal and access somebody to assist you with technical issues. Although, again, you can reach out to us at aging@jewishfederations.org. Thank you. I'm going to pass the mic back to Alana.
Thank you, Amanda. Next slide, please. So we're going to wrap up with the next steps for what you'll do from here if you're interested in applying, and then we will conclude with a Q&A. Next slide, please. So your next steps are to visit us at the call for applications page. The link is there and it is also present in the chat over and over again. You'll find our RFP there and all of the related documents, resources, templates, samples, etc. that we have referenced, as well as the recording and slides from this presentation will also be there. We'll also, after April 24th, be adding the additional Q&A document to that page. So bookmark that link. And if you are interested in applying, we'll ask that you create your SurveyMonkey Apply login and submit your intent to apply or LOI by April 15th. And then after that point, if you're interested in proceeding, we encourage you to begin your stage 1 application as soon as possible. Again, submitting it at least 3 days prior to the application deadline to allow time to address technical questions. Applications submitted after that date will not be considered. You won't have the opportunity to through SurveyMonkey apply. It'll be stopped. Again, if you have questions about the RFP and program guidelines, not about individual proposal ideas, you can write to us at aging@jewishfederations.org by April 24th. I do want to make you all aware that we will have some office closures for the Passover holiday, so responses could be delayed. Our offices will be closed April 2nd and 3rd, as well as April 8th and 9th, with some limited hours in between, which I'm sure is true for a number of your offices as well. And again, even if you decide not to apply or you apply and are not awarded funding, you can always stay in touch with us and participate in our trainings and other offerings, receive our newsletters. If you'd like more information, write to us at aging@jewishfederations.org. And you can also find us on LinkedIn. We are the Center on Aging, Trauma, and Holocaust Survivor Care. We encourage you to follow us there. At this point, next slide, please. We are going to open it up for questions and answers that have been submitted in the Q&A box. So we'll go ahead and stop sharing the presentation, and those of us who have presented will come back on camera. There are others of us available as well with our individual areas of expertise. And I'm going to ask the questions, and I'll rely on my colleagues here and myself to answer them. So one question we've received a number of times is, how many grants do we plan to award during this funding cycle?
The exact number really depends on the number of applications that we receive and the quality of applications, and the funding levels requested. I can say that previous innovations program cohorts have included approximately 20 to 25 subgrants.
Thank you. And similarly, there's been a question of how many applications did we receive in the last cycle? Approximately, if we have an idea. A lot. Thank you. And another question is, can we give an example of whom would be considered older adults having experienced trauma? For instance, could this include unhomed individuals or facing evictions, those receiving counseling services? So it's any older adult age 60 or older. And what would you add to that, Leah?
Well, we don't want to determine what's considered a history of trauma for any individual. And so you can find the definition of older adult with a history of trauma within the RFP itself. And we use it based on the older adult is defined based on the Older Americans Act, which is why it's 60 and older and not 65 and older. Um, we can say that this trauma exposure can be considered physically, emotionally harmful, or life-threatening. It has lasting adverse effects.
Thank you. And I can add that you will not be asked to demonstrate that a participant has had a history of trauma. There's not going to be a audit of that. We are going to trust your expertise in assessing that for your service population. Um, Here's a question on behalf of Jewish federations, local federations. If we are a federation and some of our organizations in the community are interested in applying, similar to the Advanced Critical Support cohort, would we apply on behalf of these organizations as one application? So are we allowing sub grantees? I think is a more important question to start that off.
We are not having sub grantees this time through the innovations program. So in other words, the applicant has to be able to provide the direct service provision for this application.
Thank you. Here's a question on the definition of innovation for Leah and Shelley. Is a program considered innovative if we are launching a program we have done before but in a new location?
Um, you can refer to our definition of innovative in the RFP and see if it meets the criteria listed there.
Mhm. Thank you. There's also some questions about would this type of project or that be permitted use of funding? One example is respite funding for caregivers. Is that a permitted use of funding? And again, we would refer you to the eligibility requirements as well as the funding limitation section of the RFP. Leah, is there anything you would add to that?
Sure. We have funded respite-focused projects before, so respite is permissible. However, we do not fund cash assistance. So if it's funding cash assistance to someone so that they can provide respite, that would not be allowable.
Thank you. Um, And let's see. Here's a question about staff development. So this is a great question. If the funding does not include staff development, does that include a specific training that may be related to a project activity that's part of the grant? For example, receiving a certification or training in a unique mental health counseling modality. So would that be a permissible use of funds, that type of training?
That's a good question. So this year we started a new policy where because we have an excellent training on person-centered trauma-informed care, it's actually very extensive and wraparound. It's about you can get earn at least 6 CEUs for that training, and you can only we will only fund projects that for training that are not included in that training. So, so if it was for a specific mental health modality
Yes.
to provide person-centered trauma-informed care, it would also have to have a direct service component to that project.
It would also have to have, Leah, tell me if I'm right, specific training on person-centered trauma-informed principles as they apply. So if somebody wanted to apply for use our funding for a certification for their professional discipline, is that something the funding could support?
Thank you for clarifying. It definitely has to have a person-centered trauma-informed link to it. So it wouldn't just be like cognitive behavioral therapy or EMDR or something like that. It has to go with the person-centered trauma-informed principles that we've laid out.
And the other important thing to note is that we don't fund external training or certifications. That is a limitation of the grant funding. So we're only talking about this in terms of if you're doing a training project and you're providing the training. So that can also be found in the RFP. Um, Here's a question about match. If claims conference funding is being used as a match for this grant, can this grant also be used as a match for claims conference funding? I think that's a question for the claims conference. Is there anything else we would want to say about that? Okay, yeah, that's a question for the claims conference, but thank you for asking because I'm sure that many present may find that relevant. So, can a federation apply if they are doing a program in partnership with their local Jewish family services?
It sounds like you're saying a sub grantee and or a secondary sub grantee, and we do not have that that that's not available this year. It's only whichever agency is actually providing this service.
Thank you. And another point regarding the previous question on claims conference funds for match is that claims conference funds must be used for the JFNA funded project if you're using that as match. And I want to thank our behind the scenes financial advisor, Alyssa, who is feeding me lines. So, so someone has asked, could the proposal be made to work for older adults in Israel, or projects can only be based in the US? They can only be based in the US because they are federally funded through the United States Administration for Community Living. Yes, this recording will go on the call for applications page later. What is our definition of trauma? So we borrow the definition from SAMHSA, and someone asked as a follow-up, are second generation survivors considered eligible for services? So as long as they are either in the caregiver category of an older adult age 60 or over, who's a survivor, who would be a Holocaust survivor in that case, or they are themselves and or they may be both 60 or older, then yes, that would be typically considered as part of that definition. Those subcontracts aren't allowed. Our organizations, this is a different question than sub-grantees. They're asking, are organizations allowed to fund subcontractors using these funds? So that could be a vendor, a trainer, a musician, something like that. And the answer is yes. There's been a few questions about if electronic hardware, IT, or software are part of the proposed implementation of the project. Would their purchase be applicable? And Leah, I'm going to let you answer that. I'm also going to see if Alyssa or Jake have any thoughts on that.
I'm happy to jump in. Hi, my name is Jake Scott. I'm part of the financial oversight team here at the center. General IT software is not permissible. You can find that under the list of prohibited items in our RFP. If you have specific questions about project necessary software or equipment, reach out to us and we can help advise. But generally, any kind of IT software equipment that is general office equipment would not be funded as part of the project budget. But if you have specific supplies, equipment that would be specifically used for this project, they may be part of the budget.
Thank you, Jake. Um, Someone asked if hard or soft match is required. I'm not really clear on what that means. Jake, I see you've unmuted.
Yeah, it's a great question. And this would be considered a hard match, meaning that if you are not able to meet the match requirement during the course of the grant, you would be considered non-compliant and it would affect the funding dispersed. So this is a hard match. We do ask you to submit evidence of your match and track it just like you would with grant funds.
Thank you, Jake. And while we have you unmuted, there's a follow-up question to the last one on software and equipment, which is what if they are part of the project, such as a laptop for the project, etc.?
This really depends on the nature of the project and the specific objectives. So if, for example, you were doing a project that a staff person needed a tablet to interact with clients, get survey results, that kind of thing, that could be considered allowable. But generally, office equipment for a staff member, something that they would not use specifically for the project, would not be considered allowable.
Thank you. There's also been a question about where are our in-person training events located, and that can vary anywhere in the country, essentially. Is there anything you would add to that, Leah or Shelley? All right. Um, those are all of the questions we received. We have a couple more minutes if people want to continue adding questions to the Q&A box. And here's one thank you. If we are working with Holocaust survivors and a group of family caregivers, do these caregivers have to be related to the Holocaust survivors, or can they be an independent group of family caregivers with a history of trauma?
Um, as you said earlier, as long as either the older adult is 60 or older or the family caregiver is 60 or older, they have to be caring for somebody who is alive. So it can't be somebody who, let's say they were caring for their mother and their mother passed away. That is not eligible through this grant.
Go ahead, Shelley.
Yeah, so edit to that. If you are not 60 or older, then the person you're caring for must be 60 or older. But if you're 60 or older and you are no longer caring for someone because they passed away, you're still eligible because you are an older adult yourself.
Thank you. Um, so someone asked, how many days are the in-person training events? It can vary, 1 to 2 days. Typically, there could be some other events before or after. This is a great question. Could the travel costs for the annual in-person training event be included in the grant? Yes, that will be in your budget and something you'll be asked for and given instructions for how to budget. And Jake, is there anything else you want to say about that? Okay, thank you. And you'll see more on that when you look at the instructions. Um, Jake, does the match have to be a cash match or will in-kind contributions be accepted?
Yes, in-kind contributions are accepted. You can submit an in-kind financial or combination of both.
Thank you. If the project training for care is If the project is training for caregivers and offers programming for the older adult they care for during the training, would that be considered direct service? It's direct service either way because we consider caregivers a population that you'd be providing direct service to. So that would be yes and yes. Leigh, is there anything else you want to add to that?
I just want to thank everyone for these great questions. We have come to time, and I wanted to thank my team for answering these questions. This is not your last opportunity to ask questions. If you have questions for clarity about the RFP and program guidelines, feel free to send them to us at aging@jewishfederations.org. And we're happy to answer your questions through April. And then there's a point at which we cannot answer questions any longer. As we said before, we cannot answer questions about specific project proposals. So we wish you the best of luck and we look forward to working with you. Take care.